am going to talk about the yolk sac. So what we have here is the yolk sac. So you can see this is an early pregnancy, and what we have here is the fetal pole, and you can see this sac that we have here. We have got the gestational sac that we have here. That's our uterus, and you can see this is what we call the yolk sac. So what is the yolk sac? The yolk sac essentially is a membranous sac attached to an embryo. It is formed by cells of the hypoblast adjacent the embryonic disc. This is alternatively called the umbilical vesicle by the terminologica embryologica, though yolk sac is more widely used in most contexts. So in this presentation, I am also going to use the term yolk sac. So you can actually see that in a normal pregnancy, you can actually have three different cystic spaces. You can have got the chorionic sac, or you can also have the amniotic sac before chorioamniotic fusion, and you can also have the yolk sac. So a yolk sac is another sign of pregnancy. So there are times during which you can have dilated ovums. It can actually present without the fetal pole, but the yolk sac can be visualized. So again, on color Doppler, you can actually visualize our yolk sac here. There's no perfusion here, and you can see the fetal pole. This is the heart flutter that you can see here. So there is a flow of blood here, and then you can see flow of blood here around the uterus. So this is our uterus. So this is our uterus, and then you can see the amniotic fluid that you have. You can see the heartbeat there, the heart flutter, to say this is a viable pregnancy, or the fetus is actually alive. There is no missed abortion. In the event that we are not going to see this fetal movement, heart movement, we are going to call this a missed abortion. So once again, you can appreciate the yolk sac that we have here. That's the yolk sac. So again, you can actually appreciate it from this end. Do not mistake a yolk sac with a twin pregnancy. So if you look closely, you can see that there is a heartbeat here, around here. You can see that there's a heartbeat here, but the yolk sac, there's no heartbeat. It's a cystic space. It's a vesicle-like. And then you can see there is this is free fluid in between here. So you can actually appreciate the distinction. So we have got our thick-hold gestational sac that we have here, double the zero sign, and you can appreciate the uterus, nice uterus that we have. So this is a nice intra-uterine pregnancy, it's not an ectopic pregnancy, and you can see it's actually a viable fetus, as I've said before. Again, you can appreciate here the urinary bladder that we have here, the cervix, and we've got our nice yolk sac that we have here. So it's a nice cystic space. So basically, in pregnancy, you can appreciate the three cystic spaces in early pregnancy: the yolk sac, the amniotic sac, and the chorionic sac. So in a nutshell, this is it in terms of the yolk sac. I hope you are doing well around the world, wherever you are. Don't forget to subscribe to our channel. I hope you're learning day and night. The practice of medical ultrasound, it needs people who are so vigilant, people who are so willing to learn and to add knowledge on a daily basis. Thank you for your time.